Qualified, professional, and compassionate doctors talking real solutions to real health problems.
On the DocTalk show today, malaria. A good doctors arm you with all the information you need to be found on the right side of that potentially fatal female Anopheles mosquito bite.
Once again, welcome to the DocTalk show. And today I'm with Dr. Amate and Dr. Darius and myself, Dr. Fiona, the sexologist. Today we discuss malaria. Malaria is one of the leading causes of deaths in sub-Saharan Africa. But in Uganda, it has persistently been one of the topmost cause of deaths, especially among children under 5 years. Most of us have been to the hospital or pharmacy with a fever saying we have malaria. Dr. Darius, what is this malaria monster that everyone seems to come with for treatment every time they get a fever?
Okay, thank you, Dr. Fiona. So malaria is a severe infection. It's a parasitic infection that affects the red blood cells of the human body. Worldwide, we have about 5 species of the parasite. The parasite is called Plasmodium. And in Africa, the dominant species that we have is called Falciparum. And this particular species has been implicated in the severe cases of malaria. The other species are kind of from a benign, a less severe, mild type of malaria. But Falciparum, which is dominant in Africa in our setting, has been implicated in the severe cases.
Thank you very much. And the burden of malaria is actually heavier than we think, with over 200 million cases per year in Africa. Globally, we have about over 200 million cases of malaria every year, with almost 250,000 deaths from just one disease, malaria, globally. And in Uganda, we still have Uganda being called a highly endemic country, where that's why everyone thinks they have malaria. So, Dr. Ama, in Uganda, how is the malaria picture? What do we have as a country when it comes to malaria?
Right. So in this country, where it's called a highly endemic area, is because we see a lot of cases of malaria within the country, and most of the areas that we see malaria in the east. We see it a lot in the central region. We also see it in the northern region, and we find malaria cases being prevalent from between 20 all the way up to 37%, which is a pretty high prevalence. But interestingly enough, in the southwestern area of Uganda, we have a very, very low prevalence, and that's around 4%. So in these areas, the people who we are usually more concerned about, we are concerned about pregnant women, particularly women who are just having their first babies. We are concerned about children, particularly those under 5. They tend to get malaria infections.
With Uganda being one of the most, like we've said, highly endemic areas for malaria, do we have people that we should be thinking of more than others?
Yes, there are. And the groups which we usually will be very concerned about are first and foremost pregnant women, particularly women who are getting their first babies. The risk with this particular category of patients is that they have a slightly lower immunity because the mother's body has to accommodate the new baby, so that it's not viewed as a
yes, and then there are also 2 individuals. The mother is carrying a child and carrying the immunity for 2 individuals.
Yes, that's
and
right.
We know that this malaria Plasmodium, the parasite you talked about, comes and clusters around the placenta, where the mother and the baby are communicating, where the baby's immunity is coming from to maintain the baby.
That's absolutely right. So of course the risk there is that if a mother develops malaria, then if it's not treated early enough, and it's treated well, then you're likely to lose that baby as well, and you can also lose the mother in the process. So it's very important that that group is taken care of.
And I think, and that is basically the reason why we give them this fast during pregnancy.
Absolutely.
To prevent mothers from getting the malaria, and thus the baby from getting malaria.
Right.
And I think the other group of people who should be concerned about are children who are under the age of 5. And this group, it's because their body systems generally have reduced immunity. Immunity basically means the body's defense against infections. So in this group of people, the children have relatively low immunity compared to the to the older
Adults,
children or adults. So they tend to get very, very severe forms of the malaria.
And that is very true.
Yes.
And that is why we are saying that most malaria deaths are found in children under the ages of 5.
That's
They
very
tend to get a lot of the complications of malaria.
Do we have any other special groups?
Certainly, we do. Some of those, like we said, there are certain areas of the country where we don't see as many malaria cases. And so people coming from those regions are more likely to also get very severe forms of malaria when they do get malaria. Again, because they're not exposed to it a lot of the time. And so they have not developed an immunity against it. And so when they get the infection, it tends to be quite severe. Another
Which is, I think, the same with people who are traveling from outside the country.
Yes.
Why people from Europe and from the US or from Asia, places
Yes.
where they don't have our kind of malaria caused by the Plasmodium falciparum, while traveling to countries like Uganda, where the malaria endemicity is high, or the malaria, we have a lot of malaria.
The malaria
How-
burden is
yes.
high.
That's why they are told to take treatment to prevent them from getting malaria.
Yes.
Because like Dr. Amati mentioned, that as soon as these people get malaria, then it will be very,
Very, very
complicated
severe.
and more severe than those of us who live in Uganda.
Absolutely.
It's all down to the immune system. Because the immune system, for people who live in the endemic, like the places which are high burdens of malaria, they tend to build an immune system which tolerates the malaria over time. So you realize these people don't fall sick as often.
And
as
don't
those
get
who-
very
and
severe
they don't get very
cases.
severe forms of malaria.
Okay.
It's down to the immune system which can.
Which
kind
I
of
think
suppress the
is
malaria.
happens with everything. That's why we can, most of us, because we have been exposed to the mosquito bites, they are people who are virgin and have not been. They are good looking to the mosquitoes, and the mosquitoes can also sense this.
Right.
With these risk groups, and of course with the rest of us, everyone being at risk of getting malaria, whether severe or non-severe. Let us see, Dr. Darius. How do we get this transmission? How is malaria moved from one person to another? How do we get it?
So, like I said earlier, malaria is a blood infection. Means a parasite is transmitted mainly in blood. But the parasite requires something that's called a vector. A vector is like a vehicle for which the disease can be transmitted.
Like a middleman
Yes,
in business.
something there in the middle. And in this case, the malaria vector is a mosquito called the female Anopheles mosquito. So people will ask, why does it have to be the female mosquito? This is mainly because the mosquito, the female mosquito, Anopheles mosquito, requires a blood meal. So it has to bite the host to get some blood, and that blood is important for it to further develop the eggs that it will lay and produce more mosquitoes.
So this female thing didn't just stop in the Garden of Eden. It's even among mosquitoes.
Yes, there's a reason why it needs the blood meal. So if it bites a person who has the parasites in the blood, it will take up the parasites with the blood. Then when it goes on to bite another person who is not infected, the process whereby it takes up the second blood meal, the parasites seep into the host through the saliva of the mosquito, and in that way the person becomes infected with the malaria parasite.
So as it sips blood
Going
from
in
the
there.
next person, it
It
injects
Gives you the malaria.
the parasites
Malaria
through
parasites.
through its saliva. So that's how the transmission goes
That is
from person to person.
absolutely right. So after this mosquito has taken a blood meal and injected this malaria parasite into the next host, we know everyone comes to hospital with fever and says they have malaria. So what exactly are the features? How people would need to know and understand that not everyone who has a fever generally has malaria, but would like to understand a person who has malaria, what would they present like?
Right. So some of the things that we see, first of all, we need to remember that when somebody gets bitten by a mosquito, they don't develop malaria immediately. There's a duration of time, about a week or so, when the parasites are maturing in the body's blood. And then once they have matured and they start spreading through the blood system, then they start causing symptoms, what we call symptoms. So what a patient will come and tell us, I'm feeling like this, I'm feeling like that.
Absolutely.
Yeah. So the first thing that somebody with malaria is they usually have a fever. And usually they'll have a high grade fever, which is how come people say, I have malaria when I have a fever.
True.
But that's not the only thing. So they'll come with chills, so they feel cold, but in reality they have a very high temperature. They're shaking, we call that rigors in a medical language. So usually they're shaking and they're shivering and they're cold, they feel cold, but they have a very high temperature. The other thing is that they tend to be very weak, they have no appetite. Some people have vomiting, they have diarrhea. It could be abdominal pain. Some people, and not just abdominal pain, some people even have joint pains, they have muscle pains. So some people come and tell you, I feel like I've been beaten, I have no energy, I feel completely weak. So those are the initial symptoms that somebody will have. They're usually quite non-specific, but given the fact that this is an endemic area, it's one of the things that any doctor, any clinician should be able to think about when they think about somebody who may have malaria.
True.
Right.
And I believe also that the population and community have learned that since we grew up, everyone saying you have malaria with fever. And it doesn't happen in all the countries, because there are some countries that do not have high levels of malaria. They also have other things they think about. But the fact that we live in Uganda, in a country where malaria is very high, every time we get a fever. And it's right to think that you could have malaria, because if malaria is not well treated, it could develop complications.
Absolutely.
Which is very true. And may I add that it is true, every fever we consider it as a malaria because of the very high, what they call endemicity. The burden of the disease is very high. So we assume any child or any adult who gets malaria, who gets a high fever, is assumed to have malaria until proven otherwise.
Exactly.
Yes.
So, like we said, if malaria is not treated,
it's certainly going to get complications.
It becomes very severe.
It becomes what we call actually very severe malaria. So as when we come back from the break, we shall see what complications could arise apart from the body weakness and the fevers and everything, how somebody can get into severe malaria and what severe malaria would look like, and that it can actually cause death, because like we're saying, it's one of the leading causes of death.
Yes.
You are watching the DocTalk Show.